Hello, everybody. Welcome to another episode of A Manic Odyssey. We have another incredible guest today, a specialist, the amazing Dr. Amara Brooks, who is a clinical assistant professor at the University of Nevada, Reno. They are also the founder of Flow, which is a company that is dedicated to neurodiversity affirming psychological care. Hi, Dr. Brook. How are you?
Hey, thank you so much for having me. I'm excited to be here.
Yes, a lot of people in my life are very pumped to know that I'm speaking to you, and they can't wait for me to learn how to better love and support them in their neurodivergence. So, just to get started, I'd love to just read your credentials because they are many. Education and certifications. You have a bachelor's degree from Harvard, you have a PhD from the University of Michigan, advanced clinical training from CSPP, advanced training in psychological assessment, DBT and CBT, board certified in behavioral and cognitive psychology through the American Board of Professional Psychology. Wow. You are well versed, you are well trained, and I love it. I want to hear about the intersection of these trainings and how flow came to be. And then for our audience that doesn't know what flow is, what is flow?
Wow, well, that's a long winding path, and I'm going to try to keep it succinct so we have time to talk about a few other things.
Yes.
So it might sound like it just sort of, I don't know, direct high-powered path. In fact, it was pretty winding. So I've always been fascinated by how to help people live aligned with their values and as an under I would and making a difference in the world. I guess those are the two common threads. And as an undergrad, I did go to Harvard, but I actually did not major in psychology. In fact, I didn't take a single psychology class as an undergrad. I ended up studying. I was somewhere between sort of government and environmental science and policy, which is what I ended up majoring in. And I was really fascinated by why people were really endorsing caring about the environment in surveys and things, and yet we're not living in alignment with those values.
Hmm.
And that was just an interesting, sort of dilemma that I would sort of leaned into. And in those days, when people thought, why do people do stuff for the environment? The ideology was in sort of capitalist economic one, where we'd say, well, if people are not doing it, it's because the incentives aren't in the right place. So I
Hmm.
studied like quite a bit of economics, quite a bit of government, but I actually ended up doing my undergrad thesis on the battle over wolf reintroduction in the American West. And I was interested in why people had such diametric, which really ultimately the foundation for that was social identity theory, but it wasn't framed that way because my advisor was in the policy school. And so we looked at kind of why some people idealize wolves, why some people, think they're terrible. Gosh, doesn't this sound familiar?
Yes.
But that was a long time ago.
Yeah.
And so it was really interesting. I then planned to go to grad school in something else kind of related to that because I was not just wolves specifically, but I was interested in that kind of policy dilemma. How do we get people to kind of communicate with each other and come to some kind of common ground? So I debated between continuing at Harvard and going to Michigan. Turned out my spouse got a job in Michigan, so that was literally why I ended up at U of M, which of course was a great experience. I was initially in the environmental policy program. There were a bunch of people there doing psychological stuff, and I was like, aha, yes, this is fascinating to me. And then after doing a master's in that, I was still looking at kind of conflict over endangered species kind of stuff. I ended up actually in the psychology department because the social identity and self-regulation research that I was interested in, all the theory underlying that, and it was becoming clear to me that the similar theory, because people are kind of people, underlied like a lot of different stuff. So I ended up in the psychology department where I got my PhD, but it was entirely a research and teaching based PhD. I was focused on self-regulation and why do people curiously not do stuff aligned with their goals related to all kinds of things, not just environmental things.
Hmm.
Um, I ended up after that going to California, and I was an assistant professor at Santa Clara University. And in that process, multiple different family members started having issues between shall we say, the demands of society, and there are neurotypes, which I didn't really refer to it by then because we didn't really have that terminology back then. But some folks with bipolar, some folks with what turned out to be autism and ADHD, and some learning disabilities, really having a lot of challenges interfacing with expectations of marriage, expectations of employment, expectations of schools. And I got to admit, at that point, I had a pretty typical kind of, I guess, pathologizing lens, like, oh my gosh, what do we do to help people just be able to do what they need to do? And I ended up leaving academia because I was so interested in these like clinical questions and how to help people who are struggling with these things. And I went back and respecialized in clinical psychology, which is basically adding the additional stuff you would have done if your original PhD was in clinical. If you had a PhD in another area of psychology, I eventually got licensed. I worked at VAs, schools, Kaiser, and then eventually, to make a long story short, in 2018, I started a private practice and started realizing I could kind of provide better, more creative, more effective care that way. Although unfortunately for a narrower swath of the population, but just can't totally win. And then I ended up focusing increasingly on assessment and treatment for, not treatment for, but treatment to help folks who were neurodivergent in a variety of ways, especially autistic and ADHD. And I would say over that period of time, that's also when the sort of more neurodiversity affirming frame started to be more widespread,
Hmm.
which I was really happy and interested to see. And so that's been the approach that I've taken. And initially, I was just a kind of solo kind of practitioner. I became very interested in dialectical behavior therapy from the beginning of my clinical training. I thought that being a sort of nerdy academic, I was going to do CBT because that's what everybody said. Like, everybody being other academics said, yep, that's what's evidence-based. And then I was in my first clinical placement and realized that lots of people needed more validation and more distress tolerance skills, essentially, to be able to do the kinds of stuff that we were asking them to do in CBT, and that
Hmm.
CBT by itself doesn't have to be quite invalidating if it was done in a certain authoritarian kind of I know best as the clinician type of way. That did not
Yep.
appeal to me. So I ended up leaning into DBT, and that's really the clinical approach that I've increasingly taken. And now on the therapeutic side, I really focus on how to tailor DBT to the needs of autistic and ADHD clients, because I think there are certain aspects that are a really great fit and certain aspects that could be very invalidating, like a lot of other types of therapy, if they're not done in an affirming way. Um, and the other piece is the assessment, trying to really make sure that we are accurately assessing and not just stuck in old stereotypes about what autism or ADHD looks like. And in that process, I was diagnosed as ADHD in grad school, which it came out when I was having to manage projects, and I was like, I don't understand how people do this, stay on top of this, like figure out how to organize this stuff, etc. And then much more recently was diagnosed as autistic as well. So I do bring that lived experience as well as supporting many family members who are, turns out, similar neurotypes. So yeah, that's kind of a long story, but
Yeah. But what an awesome winding road. Like no kidding. That is like what a journey you cannot predict the ending of. And it seems like
totally.
you're right where you're supposed to be, and I love that. That's super cool. Your website uses the idea of flow, which is a state of
Right,
mind
I
of
forgot to
creativity.
explain that. Yeah, yeah. So, it's interesting, autistic folks and ADHDers often get pathologized for being too into the stuff that they're interested in. I
Hmm.
think people don't think about it that way, but they're like, why do they just always talk about that stuff? Why do they, constantly go on and on? Like, why are they more interested in, doing their special interests than like hanging out, doing typical, neurotypical socialization? And actually, it turns out that that is a great strength for many autistic ADHD folks. There's all kinds of amazing, societal creations that have come out of that. Um, and I will say, just riffing off the name of your podcast, A Manic Odyssey, that's also true for bipolar folks. I did a lot of research on and clinical work in bipolar when I first did my clinical respecialization, because I did know some folks who were bipolar, and it turned out that I was just really interested in that approach. But similarly, there's also a very affirming and a very non-affirming way to look at the differences in bipolar. And in any case, so flow it was originally described by, and I'm going to skewer his name, Mihaly Csikszentmihalyi. And I have a link to a podcast bit by him on my website, who described the state of people getting automatically, effortlessly, totally focused on something that they are intensely interested in. And it's actually really celebrated as kind of an optimal psychological state,
Hmm.
in the kind of productivity oriented work world. It gets celebrated as we want our employees to get in the state, so they're so intensely interested in doing
Yeah.
amazing work without us having to like just kind of force them to do it. It does get kind of pathologized as either hyper focus in ADHDers or not to see people being kind of stuck or locked in or on their, consuming kind of special interests. But the naming my practice out was really a way to try to really highlight and validate that natural strength of autistics and ADHDers, and really reframe it as being something that can be amazing for both mental health and for the world. So that's kind of where that name came from.
I love that. Yeah, you're totally right. It is very pathologized in neurotypical people to say it, right? When we're talking about people who are autistic, who have ADHD, or who are ADHDers, right? Like we're saying, "Oh, why are you perseverating on this? Why are you stuck on this?" Instead
But
of framing it and kind of meeting them at that strength. I love that. Great.
yeah.
That's super cool. And yeah, your website says you take a strengths-based approach specifically, which is
So I would say yes and no.
okay.
So I do say we do want to highlight strengths that are there. We do want to recognize what's called the social model of disability. So there's different models of disability. There's kind of medical model that says people have trouble because they have fundamental deficits in them, and we need to like fix them, cure them, et cetera, to get them to like be normal.
Hmm.
And then there's the social model, which basically says that disability results from a disconnect between what people are good at, what they do, and what society expects of them. So I would say I do, of course, want to highlight and lean into strengths. And at the same time, there are real difficulties and real disability that people experience as a result of being in a world that doesn't necessarily celebrate or validate or emphasize the things that they're good at. And people do need supports because of that disability related to the differences between what they're good at and what society expects. So I
Yeah.
would say screen space, yes, but not in a kind of toxic positivity. But let's just focus on the good stuff
Right.
and
Right.
not like focus on the negative stuff. I think we really really want to validate,
Yeah.
help problem solve, help get supports for them, and things like that. So
Yeah, perfect. And yeah, and you're leading right into my question, which is how do you specifically define neurodiversity and why is this framework important in understanding individual differences?
great. Well, I didn't define the term neurodiversity, by the way. That's been around for a couple decades, but it's really picked up speed in recent history. And it was developed, the idea was developed by a bunch of neurodivergent folk in kind of the 90s, and then Judy Singer kind of picked it up and published the initial, sort of put it in academic publication. Nick Walker's talked a lot about it. And so the idea of neurodiversity is just that there's diversity in human brains and the way that our brains function. That's it. I mean, neurodiversity is all of the diversity in human brains, right? Neurodivergence is a brain, or neurodivergent is a brain that differs from the way that brains are typically expected to function. So, you know, autistic, as somebody who's autistic is neurodivergent, somebody who's ADHD is neurodivergent, somebody who has a learning difference like dyslexia is neurodivergent. Somebody who has epilepsy is neurodivergent. Somebody who's gifted or has an intellectual disability is neurodivergent. So it's when brains differ in, from the expected norm of how brains are expected to operate. But neurodiversity is all the diversity in human brains, as
Yeah.
is neurodiverse. So that is something I see the linguistically kind of not used inaccurately pretty often. They'll say, oh, a neurodiverse person. Well, a person is not neurodiverse unless they're like a, system, such as in dissociative identity. A person is either neurodivergent or neurotypical. But yeah.
Gotcha. So they're either neurodivergent or neurotypical on the neurodiverse spectrum.
Yeah, well, neurodiverse is all the diversity of
All of the
human
diversity. Okay,
brains.
got it, got it, got it, got it.
What
Yeah,
I
because
was
you're
getting
right. I'm,
at.
I'm getting kind of lost in that language, and I'm realizing that it's tossed around kind of interchangeably, but I'm hearing you say that it actually has a specific frame.
Yes. Well, like people will say, I work with neurodiverse clients. I'm like, so does everybody. Like all clients are part of neurodiversity,
Yeah, yeah.
right? What that really means is I work with neurodivergent clients in some way, clients who are neurodivergent in some way. An individual is either neurotypical or neurodivergent, not
Okay.
neurodiverse, right? A couple could be neurodiverse if they have different neurotypes, right? A
Hmm.
group of any sort could be neurodiverse if they have different neurotypes. So,
Perfect. Oh, that makes that okay. That makes sense. Next question: how have historical perceptions of autism shaped current understandings of this topic of neurodiversity?
oh gosh, that is a huge, a huge topic. I'll try to keep it not too long, but um, so autism was originally, conceptualized as something that was, non-speaking young white male children. It was initially conceptualized as something that, for the most part, overlapped with intellectual disability. Um, and so there's a lot of very stereotypes about autism. First of all, neurodiversity is broader than just autism, right? As we
Hmm.
just talked about, right? So
Hmm.
it's often people use neurodivergent or neurodiverse as synonyms for autism or ADHD, but it is much broader than that. In terms of the history of autism, it was originally characterized like in that very stereotypical way. So, non-speaking young white boy in a corner and no interest in interacting with anybody, very odd interests, that kind of thing. And so, there's a lot of stereotypes in the history of autism, which means there's a ton of, as we understand autism as a broader thing in more recent history, a ton of adults, including myself and many others, who were not diagnosed as autistic when they were younger because of the stereotype of how it presented. And I would say the same for, not the same stereotype for ADHD. The stereotype was a hyperactive, interrupting, intrusive, young white boy bouncing around the classroom causing trouble, and that's led to missing many people who did not fit that stereotype, including girls and people who aren't hyperactive, among others. So,
Yeah, yeah. No, that makes sense. That's a lot of room to confuse what we're seeing versus like what the stereotypes are. Yeah, because
totally.
especially like if you talk to parents or older, the generation kind of above me and above them, when they are explaining autism, that is kind of what they're thinking of. They're thinking of stories with where kids are acting in that way. And even if it isn't a small white boy, if it's a small black child or a small Asian child, they're still categorizing it in that
Mhm.
way. Like, oh, it's
Right.
because they are acting like this, not because of
Right.
other things. Yeah. Okay, that
Yes.
makes
And it
sense.
means the people who've tended to get missed are people who are assigned female,
Hmm.
Children of color are actually much more likely to get missed for an autism diagnosis. They're more likely to be given something much more pathologizing, like oppositional defiant
I was
disorder,
just gonna say, yeah, they love
or
throwing that one
conduct
out there.
disorder,
Yeah,
or something like that.
yeah,
Um, People who are highly verbal are more likely to get missed. People who are extroverted are more likely to get missed.
yeah,
People with, I mean, if people have such a profoundly gifted level of intelligence that they then appear overtly odd, they're perhaps likely to get what we would in the past call Asperger's, which is a problematic name for a variety of reasons. But
yeah,
they were but perhaps likely to be given an autism label, but even then people would try to kind of avoid it and say, oh, they're just gifted, they're not autistic. And then in
yeah,
fact, significant overlap. So a lot of folks have been missed. That also creates lots of complexity for assessment, for example, where a lot of assessors still have pretty typical deficit-based views of autism. And a lot of parents, grandparents, teachers, and others who are doing rating scales and so forth for an assessment are unbeknownst, autistic themselves. They're like,
mm,
oh, nothing different about this. This is like everybody in our family. Well, guess what? They're really genetic. Most of the older people weren't assessed or diagnosed. So,
yeah. No,
yeah.
that leads you're leading me right into my next question. So I'm very grateful for this. What are some of the biggest myths about autism that persist in public discourse today?
Oh gosh, so many. That people outgrow it, that if people are not diagnosed with their children, they're not really autistic.
Mm,
That it's a thing that is mostly boys, whereas the updated data are showing the gender or the sex distribution is much more less discrepant than they thought in the past. That autistic people are not interested in having or keeping friendships. That autistic people are introverted. That there are typically language delays, which is not necessarily true. That people have overtly odd interests. So they think that and a lot of these honestly are shared by, I hate to say this, testing psychologists as well,
mm,
right? They'll say, well, they talk constantly about makeup, but that's like just a normal thing. So that couldn't be an autistic thing. I think another misconception is that the types of stimming or self-stimulatory or sensory seeking behavior that you might see in autism are limited to a few stereotypes like rocking, and not even just if you rock in a rocking chair, that wouldn't be autistic because that's normal. But if you rock side to side or you're doing overtly weird looking rocking, then that's autistic. Like that doesn't make any sense. But hand flapping, immediate echolalia, where you just say the only things you ever say are exactly what somebody just said to you, exactly how they said it. And this is very limited. There's all kinds of other stimming that can happen. So, that autistic people are obviously different the moment you encounter them.
mm.
I mean, I could go on and on, but there's
Yeah.
a
Well,
lot of stereotypes that
yeah,
don't fit reality.
feels like we could do a whole episode on just the myths, not having without having to go into all of the specifics because there are so many. Just generally, what are kind of the deficits and the harm that come both for the people who have autism or who are autistic and the people who are neurotypical, right? So what's the harm that autistic people are experiencing from these myths and the harm that neurotypical people are experiencing by not knowing the truth and perpetuating these myths?
Yeah. Well, I think it means that a lot of people are not accurately understanding themselves, so they're not identified as autistic. In fact, but as these myths are becoming known to be myths more broadly, more people are seeking out seeking out assessments to see if they might be autistic, but they may encounter an assessor who's still stuck in those myths, and then they get invalidated again. And I know that you've done enough. I'm just going to say a little bit about validation. I know you've interviewed lots of folks in the DBT community, so you're probably very well aware of how harmful invalidation can be.
Hmm.
But when we are getting inaccurate feedback from others about our perceptions of the world, we're being told that we're making something out of nothing. We're being told that the way we see things doesn't make sense, that our emotional reactions are not justified. That creates all kinds of social emotional harm and
Mhm.
trauma that ends up resulting in emotion dysregulation, suicidality, self-harm, and all kinds of things. So when we don't understand the accurate reasons why somebody is doing something, then we end up coming up with our own stories about it. And many of those stories are much more negative and pathologizing than the accurate reality, right? So a
Yep.
lot of people get labeled with other things. They don't get appropriately accommodated because people think they're just trying to be difficult or they're just not trying, which is another invalidating thing when you really are.
Yep.
And so there's a lot of harms. Yeah.
Yeah, yeah. Wow. No kidding. And then in an effort to kind of, I imagine autistic people in an effort to kind of mitigate, right, that harm because you're existing in the world and you are receiving some of those signals where it's like this, your existence is no longer acceptable in many ways to a lot of
Mhm.
people who are perpetuating and believing these myths. How does the concept of masking impact autistic individuals and what can be done to support them in being their authentic selves?
That's a huge issue. So when society is what we call ableist, and they say this is the only way it's acceptable to be, basically,
Hmm.
and if you're not that way, then we're going to punish you. And especially if we don't recognize that there's a valid reason that you're not that way, um, that creates an urge to hide who you really are. So this is based on the emotion of shame, which you've also probably heard about from the DBT folks that you've interviewed.
Hmm.
So shame is a fear of how other people would treat us or react to us if they knew the reality about us. And so the behavior that goes with shame, that results from shame, is hiding. So we hide, we attempt to hide who we are in an attempt to not be rejected by other people. And this is a deeply rooted in human evolution and history emotion. So if you think about if we evolved in tribes or groups, and if we got kicked out of the group, we'd probably die. Then we had a strong motivation to conform to what the group expects in order to survive and thrive. And, in modern society, most people, including autistic people, want to have friends and loved ones and be accepted. And so it is, I mean, if you look at social psychology, like people do a lot of things to conform to what groups expect. The problem is if who you are and how your brain is wired is different than other people in the group, right? Like everybody puts some kind of effort into, impression management, kind of like conforming to group norms. There's all kinds of data about that for typical people. It is a much heavier burden and much more difficult for people who have a lot of differences from the group, right? So if you're really different from the group, then you are having to try really hard and you're having to do a lot of things that are not a fit for your neurotype in order to fit into the group's expectations. And that is a huge, heavy, very difficult burden. So not only does that shame and masking, there's data on this, contribute to, a lot of mental health problems, emotion dysregulation, suicide and self-harm risk, all of those things. Unfortunately, the data also shows that neurotypical folks aren't even convinced when autistic folks try to mask. Like sometimes we can do it and we can pass, and other times we can't or we don't quite pass. And there's some data that even they may view our attempts to appear neurotypical as being deception. So if I'm trying to look like I'm like everybody else, but I'm not quite there, humans really don't like deception. I mean, understandably, right? Because it's kind of dangerous if somebody's lying to you. You want to like recognize that and call it out, right? But if we're trying desperately to fit in, not only is it super hard for us, which contributes to autistic burnout, which is a whole extra thing, and contributes to self-harm and suicide risk and what have you. Additionally, they may be turned off because it seems like we're trying to pull wool over their eyes. And they've actually done some studies where they showed that if you told somebody, hey, this person may look different because they're autistic, people go, oh, okay. And then they're somewhat more understanding. But if you're just trying to pretend like you're typical and you're not quite getting there, then they think you're trying to deceive them and they dislike you even more.
Mm,
So there are a whole host of problems with it. And it's not to say that, like I said, everybody puts some effort into kind of fitting into group norms, but if people are really different, that may not be a reasonable burden for everybody, right?
yeah.
So I think from a diversity standpoint, we're increasingly realizing that with some things, but I think ableism in terms of how people act is one that is very poorly understood. Most people don't recognize that they're even doing it. They may not realize that some characteristics of the person they're interacting with are things outside of the person's control. So one thing that I see actually a lot, I've seen it in my own family, is ability or inability to regulate tone of voice.
Hmm.
So for example, somebody may have a tone of voice that's a little bit monotonous, and other people think that they're not acting interested, that they're like being disinterested, they're being disrespectful, or some people have a tone of voice that's a little loud, and other people can misinterpret it as like being angry. And if people don't realize, like, hey, this is just a difference, like, we need to not be interpreting this in a neurotypical way. This person's voice may just sound how their voice sounds. And if people know, oh, that's because you're autistic, that's part of an autistic difference, then people are more understanding than if they think you're being rude to me, why are you yelling at me, things like that. So I think it's really accurate for people to be, understood that there's a valid reason for that difference and for not to be something that other people are giving the flack about.
Yeah, totally. No, that makes perfect sense. And as we're talking about like trying to fit in and what groups are going to kind of coerce you, whether in a benign way or in a not so benign way, to be more like the group, I want to pivot to the kind of more some of the corporate questions. So with ADHD and learning disabilities specifically, right? How might learning disabilities impact professional communication or performance, and what strategies can help mitigate these challenges in that setting?
Yeah, well, I think it depends on what the learning disability is. So I'm going to put on my kind of assessment psychologist hat here. There's a lot of supports that can be provided if we're aware of what somebody needs. But for somebody to feel safe to ask for what they need, we have to create a culture where we say, okay, well, that's what you need. We'll figure out how to accommodate it, right? So for example, with ADHD, people may need help with, executive functioning supports, right? That's kind of a core difference in ADHD. So ADHDers absolutely have fabulous creativity. The hyperactive impulsive ones can have an incredible amount of energy. I would refer you to the How to ADHD YouTube channel is amazing. I don't know if you've run into that with Jessica McCabe, who's an ADHDer, has created all these great resources, and has a book by the same name, How to ADHD, that's quite affirming. And also has a great clip that I actually will sometimes play in like feedback sessions with combined means both attention differences and hyperactivity impulsivity. And it's my top 10 favorite things about having ADHD. And I think, there's things like having a lot of energy. Well, don't we all want employees who have lots of energy? Right. But then that also means they might every once in a while, like, if they have a lot of energy, they might also have impulsivity and they might do impulsive things. Well, that could be amazing because they take a risk somebody else wouldn't take. Right. Richard Branson, head of, Virgin Airlines, well-known ADHDer, has done and taken business risks that maybe other people wouldn't. Like ADHDers can be great entrepreneurs, but if we're gonna, I think the unfair part is that in corporate America, sometimes it turns into, oh, I want those strengths, but I don't want them in other ways to act anything like an ADHDer. Like they should never, miss an email. They should not need additional reminders. They should, but ADHDers can really benefit often from additional supports in terms of reminders and things like that. Maybe having executive function kind of coaching to help them with things like planning and organizing, having things provided in writing or having things in an easy to find a place where they can get them if they happen to misplace them or they happen to miss something for a moment in a meeting. So there's accommodations that could be provided. For learning disabilities, things like for dyslexia, having ways that people can listen to things rather than having to necessarily, um, read everything. In terms of there's ways of presenting information. If you even just Google kind of like writing guidelines for dyslexia, things like having less text, having bulleted text, having less volume that somebody has to read. Things like that can be really, having things like spell and grammar checking, because that kind of thing can be something that some people struggle with dyslexia. A lot of dyslexics who have had a good intervention, they still struggle with slower reading and they still struggle with spelling, for example. Well, that's an easy fix these days. Come on, let's not let a spelling, issue turn into why did this person doesn't care or something. That's just, nonsense. For dysgraphia, I'll give you an example in the college setting, which is very frustrating to me. I have one of my kids is dysgraphic and is in college, and with unfortunately, I mean, AI has, pros and cons, but unfortunately, one of the things is a lot of um, college professors are struggling with how to make sure their students are doing their own work. And some kids who are dysgraphic, especially if there's a graphomotor aspect of it. In other words, they have trouble writing, or if they write, then that interferes with them having the capacity to really fully express their ideas. They could easily have an accommodation like being able to dictate, or in terms of being able to write papers, like why don't universities have a set of non-internet connected typing devices that students can, do an exam on? But I've seen professors, including my own child, say, well, everyone's just going to come into class and they're going to handwrite everything because I'm not going to have AI. And my kid had to be like, I'm sorry, but I have a learning disability that it's documented that, and really advocate for that. But it's another burden on the students, right? Or on the employee. And I want to call out employees. Some employers do a great job of accommodating. Unfortunately, and I'm speaking from my testing psychologist hat here, um, employers are not supposed to retaliate when somebody asks for accommodations, but they're actually allowed to say, oh, well, it looks like the person can't really do their job. And then they use that as an excuse to fire them.
Mm.
So I think that's extremely unfortunate of course, when that happens, and unethical, but I've seen it more than once with my own clients. And so, I think that is very unfortunate, and, employers don't need to handle it that way, obviously. I think the other thing is sometimes they will just, they'll just target the person in the next round of layoffs, and then they don't have to say that they were actually retaliating for accommodations. But other employers, there's some good examples of that have like neurodiversity hiring initiatives. They'll, provide needed support in those environments. And, the companies that do that really benefit from that, because there's lots of strengths that neurodivergent employees bring to the workplace. And if we're willing to do a little bit of extra to accommodate them, then we get a pile of benefits in terms of their, brilliance in the workplace.
Yeah. Wow. That's so helpful. Like I know I can think of people already who are gonna very much benefit from that perspective. And hopefully, hopefully there is more advocacy and pushes towards culture changes in some of those settings. I definitely think it's very possible. We referenced ex
Sorry, could I add one other thing I forgot about with that?
Yeah.
Um, so I think there's a recognition for autistic employees, especially increasingly for, maybe they need more direct communication, for example, right? Maybe they may, things like that. I think one thing that's not recognized, and employers are rightly trying to make sure that their workplaces are more safe and kind and people are respectful to each other. But unfortunately, because autistic folks can have a very direct communication style, maybe they have differences in regulating their voice tone, tricky communication, like, giving people feedback, the expectations in terms of performance reviews and how nuanced those are. I've seen multiple cases in which autistics have been penalized because the way that they communicated with an employee regarding feedback or something was perceived as being not aligned with the company's standards of polite, kind, nuanced communication.
hmm
And there's, I think, a real, and I see this, I've seen questions like this very frequently from under other therapists and testing psychologists, like that companies don't recognize that directly communicating, not sugarcoating, being just very direct, being maybe perhaps a little blunt at times, is part of our disability, right? It can be a strength, but also it's not something that you should be allowed to penalize somebody for, right? Like
hmm
that's directly punishing them for their disability, right? And if you want to make sure that every piece of feedback conforms to some really complicated, subtle hint dropping, psycholegal standards for communicating feedback, then you need to provide support for that rather than punishing your employees who are autistic for communicating in an autistic way that they don't even know they're doing. And
Yeah.
then the last piece of soapbox is that I see women getting even more penalized for that because there's a whole literature on female leaders being expected to lead in a way that is more direct, more nurturing, more soft and stuff. And so there's an interface between discrimination based on autistic communication style and discrimination based on expectation of some female leadership.
Mm.
That is an absolutely intersectional double whammy
Yeah.
for women in the workplace,
Yeah.
and something we need to do a lot better job of supporting. So,
Yeah.
sorry.
Well, once again, you've passed the ball perfectly to the next question, which is we're going to move on to the intersection of neurodivergence and gender. So, how do ASD and ADHD present differently based on gender, and what factors contribute to these variations, or what known factors?
Okay. Well, first of all, I say from an affirming perspective, we prefer autistic rather than ASD where it's not necessary.
Ah, I made a note. Heckin' damn it, I do that. One more time. I'm going to ask this one more time. Thank you
That's
for your
okay. I mean, I
patience.
just wanted to, yeah. I
No,
mean,
it's
we
as
have to use that
we,
when we give a diagnosis, but besides that, in conversation, we try to, let's stay away from disorder any
yes.
more than we have to.
Well, I appreciate the clarification. Truly, like it's part of the language because I'm realizing more and more with people who are not in it every single day. Like I used to be more in it when I was working with kids on the spectrum, and I was a lot more aware of what the impact of certain words meant. When you're not in it all the time, you're inundated by kind of like what the culture is doing. And so, yeah, we hear ASD as like, oh, like that must be what it is, right? But then I
Mm.
have our last conversation where, and Dr. Failing did a good job of clarifying this for me too, of maintaining the dignity of saying you are an autistic person versus you are someone with a disorder, right? Disordered thinking. Okay,
Mhm.
so reframing the
And
question.
I would say that, so one other thing with that too, while we're talking about language, I promise I will stop quibbling about language, but it is really important in terms of the affirming perspective.
Yeah.
So also like on the spectrum is not really preferred either because that is what we call person first language. So person first language was promoted for a while for in the mental health world because the idea was there's this bad thing and we don't want to make it the whole person, right? So we'd say person with, bipolar, person with schizophrenia, person with autism, et cetera, or on the spectrum or things like that, which are basically kind of euphemisms. Now, of course, if the client themselves wants to be referred to that way, we're gonna respect what they want. But the studies show that the majority of the autistic community does prefer autistic over person with autism, person even worse with ASD, because that brings in the disorder part, person on the spectrum, that kind of thing. So I'm not saying that as a criticism, but I just wanted to let people know, please use identity first language when you can. It's a little harder with ADHD because there's not a commonly accepted alternative to that. Ned Hallowell, who wrote the Driven to Distraction, Delivered from Distraction, etc. books, he's a MD who's an ADHDer has suggested variable VAST or variable attention stimulus trait. That is obviously you're looking like you never heard of that before. So yeah, that is not has not caught on in a
Yeah.
major way. But I
Yeah.
would say the sort of identity sort of first approach would be like a ADHD person or an ADHDer, but we don't have a great solution for ADHD because we just don't have an autistic kind of equivalent, even though um, that would be ideal. So
That's very helpful to know because I genuinely had zero understanding of the potential implications of the word spectrum. In fact, spectrum has been presented as a positive choice, like oh, you're
mhm,
being mindful of this vast, diverse,
mhm.
neurotypical or neurodivergent group. What what is it about that language that is? Because I heard what you said, but I'm still confused as to like what can I say, or if I'm hearing somebody say like, oh, this person's on the spectrum, what's like a gentle way to correct that without it coming across as like, I don't know, tone policing.
I might say that it's more affirming to call somebody autistic than to say they're autistic than to say they're on the spectrum, right?
Okay.
And in using, so we'd say that's identity first language. Autistic just like being other aspects of identity. You'd say Black American, not American with Blackness, or Hispanic American, not American with Hispanicness, or gay man, not man with gayness, right?
Mm,
So we're talking about autism as part of our identities, and we're going to say, autistic person or autistic woman or whatever. So generally, identity first language is preferred by the autistic community. And then, like I said, we always want to respect whatever the client prefers. But on the spectrum, I mean, I think the spectrum part, personally, in my opinion, is not huge. The spectrum word itself is not hugely problematic in the sense that it can recognize that there is diversity. And Matt Lowry has a wonderful graphic, which is like sort of the autism spectrum, and it's like a sort of rainbow wheel. Um, and if you um, uh, Google Matt Lowry, Lowry, you'll find his website and he's got a great graphic of that. So I think the spectrum word isn't a problem, but it's on the spectrum. It's kind of this idea that like it's separable from ourselves, whereas autism is something that affects all kinds of parts of our lives and it's very deeply integrated in like all kinds of aspects of who we are. So on this part, somebody's made a cute infographic that has like on the spectrum, like somebody's standing on top of a rainbow, and it's kind of like that doesn't really make sense. It's not separate from us. Like we are autistic, we are not like standing on the spectrum.
yeah.
But yeah, so
Okay.
it helps, I
Perfect. Well,
guess.
now I can say the question how I would like to say it, which is
Okay, thank
how
you.
do autistic people and ADHDers present differently based on gender? and what factors contribute to these variations?
Mhm. Well, I will say, as a non-binary person myself who really kind of detests gender norms, I just want to point out that there are some generalizations, some average differences, but
Mhm.
these differences are not unilateral among people of a particular gender. For example, I would say, so I'll give you some average differences,
Mhm.
like on average, how, assigned female versus assigned male people may present different. Um, for autism, and I would refer you to a bunch of great resources from Donna Henderson on this, who's done a lot of the work on this. She's the author or the lead author on the Is This Autism books that talk about differences in autism presentation. Not just it's more like just sort of untraditional presentations of autism, but um, it has also done some podcast episodes as part of the Testing Psychologist podcast. So again, Donna Henderson talking about gender and sex differences and autism presentation. Boys and girls are socialized very differently, and so I think it's unclear how much these differences are based on basic biological differences versus based on gender socialization,
Mhm.
because there's much more of an emphasis on subtle social communication and social conformity and nurturance and things like that among female presentations, so among girls. And so that could be also part of what contributes to the differences, but some generalizations with all those disclaimers. So there's some evidence that girls tend to have fewer and less obvious what we call repetitive behaviors. So stems, for example, like so self-stimulatory behavior, repetitive behaviors. Girls might twirl their hair, they might pick at their skin or pick at their nails, or do other sort of more subtle and more kind of gender conforming kind of repetitive behaviors rather than maybe rocking, hand flapping, things like that. So I would say like broaden the idea of like repetitive behaviors could be any kind of repetitive movement, could repetitive, they might read the same book over and over again, watch the same show over and over again, have kind of cute like catchphrases that they say over and over again, repeat the lines of movies or TV shows. But girls tend to have um, different repetitive behaviors, and there's some evidence that also less of those. Um, Also, in terms of the sort of need for routine and like difficulty with kind of going with the flow. Girls, that may be less obvious for girls. And In terms of intense interests, the interests may be more likely to be things that are sort of considered acceptable for girls to be into, horses, animals in general, makeup, other people, kind of interests that are more like seen as more typical and in particular more typical for females. And like I said, it's hard to tell whether is that because they are, there's some biological difference, or is that because when they were, rocking at some point, they got flack for that. So they started twirling their hair instead because they didn't get flack for that. It's a little hard to say.
Yeah.
And then in terms of the social communication part, that there's some evidence that autistic girls have somewhat higher social motivation, and which means they're like more intensely wanting to be part of relationships and social groups and things like that. And that they may just have less obvious social differences. I know there was one study that found that the social communication sort of style and development of autistic girls was somewhat similar to neurotypical boys, but not because generally females are social, like I said, socialized, and maybe there's some genetic difference where they tend to have more subtle, more advanced social skills anyway compared to boys, but there is some evidence that like autistic girls more resembled neurotypical boys. So in any case, less obvious differences and ones that look more kind of female typical for also tend to be more verbal and tend to be missed for diagnosis a lot. Girls also tend to have um, more anxiety and depression. They tend to be identified later. And so that also provides space for the autistic differences to get misattributed to anxiety or depression because there's a more sort of, they start having social difficulties then with peers. And we all know about mean girls in late elementary, middle school, high school, whatever, right? So you can see how badly that goes.
Yeah.
A lot of girls aren't identified until they're like, till the social situations start getting more complex around that age, sort of late elementary, middle school. Then they get identified, but by then they may also, nobody may be trying to identify anything until they're like in a mental health crisis. So then you get things, get it like autistic characteristics getting misattributed to, to side effects of anxiety or depression.
Mhm.
So it's a complex thing. So that's just a few ways that presents differently, in terms of autism. I
Yeah.
could say more about ADHD, but do you have any questions about the autism stuff first?
Yes, I really do. I really do. Because I know that we're speaking on averages, and I also detest the gendered language. So I'm here. I'm there with you. So it's very helpful to keep in mind like how many factors are at play here. So and also don't turn off the hose unless I raise my hand. Like I'm here for the information. I want it. What came up for me as you were sharing was I'm wondering, is it possible, or does it happen, or could it happen, where in in girls the autistic behaviors that are being misattributed to honestly more socially typical presentations of like anxiety, complex PTSD, depression, um,
Yes.
gosh, I'm trying to think like picking, OCD, right? So like all like things that are overdiagnosed
Yeah.
in women.
Yeah.
Could those be missed behaviors in autism? And then follow-up question before you answer that. The medications that are then prescribed to mitigate some of those, do those then kind of increase the behavior because you're not addressing the autism?
Um, yeah, those are two different questions, but yes, girls and women are often misdiagnosed or either they're misdiagnosed or they're diagnosed, but the autism is missed. So what I mean by that is women are very much more highly diagnosed with borderline personality disorder, for example. I can't tell you the number of times I've heard like DBT therapists or testing psychologists saying, oh, I've got this like 13-year-old girl. She really looks like she's got borderline personality disorder. And then, first of all, it's just questionable to diagnose in that age of a person
Yeah,
anyway. But
yeah.
also, then you hear about it and you're like, yeah, that really sounds like autism from the perspective of somebody who really knows autism and,
Hmm.
assign female people well. Um, a lot of girls and women also get diagnosed only with anxiety or only with depression or only with OCD or only with, well, the whole issue of bipolar being diagnosed when it's not really bipolar is a whole separate issue, but bipolar is often a common. If people are using such a broad diagnostic criteria for bipolar that any sudden emotion dysregulation is being diagnosed as bipolar or any super intense deep dive into interest as being diagnosed as bipolar, you get a lot of girls misdiagnosed with bipolar and or borderline when there's an underlying autism and or ADHD going on, and that is missed. Now, sometimes the diagnosis they're given, like borderline anxiety, depression, OCD, is a misdiagnosis. Sometimes they also have those things.
Hmm.
It's just underlying anxiety, autism or ADHD reason contributing to those things in an unaccepting society is not being recognized.
Hmm.
And so essentially, we're kind of just treating the fever rather than treating what is underlying. I don't like love that analogy because it's not an illness, but like the
I
underlying
gotcha.
thing that's
Yeah.
kind of causing that, right? It's like
Yeah.
treating pain, like giving Tylenol instead of like figuring out why do you have pain,
Mm.
right? Is probably a better analogy. But yeah, so there's a lot of missed diagnosis. And then your second question, I would say from a neurodiversity affirming frame, we're not trying to treat autism or treat ADHD. We're trying to help people who are autistic or ADHDers be able to, survive in a society that is not, and thrive hopefully in a society that's not really designed for them.
Hmm.
But yes, if we're throwing meds at something where like, there's a fundamental neurodivergence underneath, then is it likely that the meds are not going to fully have the intended effect? Sure. I mean, sometimes autistic and ADHDers, need meds because of these secondary kind of I like Jessica from the How to ADHD kind of refers to these emotional sequelae of living in an unsupported ADHD as being kind of malware. I like that kind of analogy. It's like we get all this stuff because like we're not being recognized, understood, or supported or accepted. Um, so yeah, that's definitely a problem.
Yeah. Wow. Gosh, that's so frustrating. So many things that could hinder the accurate. Just like, DBT is all about building that life worth living, right? So finding ways to, decrease suffering, increase purpose and happiness. And it can be so challenging to have
Mhm.
something um, hindering or like not having the information, like not having the full pieces to the puzzle that is
Yeah.
you, right? You don't get to fully experience or explore your identity if you don't fully
Yes.
understand like what's going on underneath the surface.
Yeah.
So,
And
yeah,
even
that.
more confusing, sometimes those secondary things can contribute to, well, first of all, girls and women mask a lot, right? So that can contribute to not being accurately diagnosed. For example, most autistic people can force ourselves to make eye contact for a limited period of time, but it's like it's exhausting, it's hard, it doesn't feel natural. But you'll see a report that says made eye contact, not autistic, or was too interested in participating with, it was too interested in interacting with me, not autistic. So they like go into this like limited period of time kind of assessment, they put on the show of normality and then they're not diagnosed, right? So that can totally happen. But also sometimes we develop secondary, like for it, like anxiety for, so if we're talking about ADHD, a sort of certain level of OCD-ish or OCPD-ish. So OCPD is or obsessive compulsive personality disorder, which is kind of hyperstructure or hyper, there's a correct way things had just always have to be done. A certain level of those things can be somewhat compensatory. They can develop as kind of a compensatory strategy for ADHD, right? So, like, let's say I tend to miss mistakes in my academic work. And so I end up like checking over my work a lot. That can be like, then I can end up, having something kind of OCD-ish going on. But actually, the fact that I do that means I don't have bad grades. I'm having to spend a whole lot more time than other people to get good grades. But nobody is saying, like, well, I'm doing an ADHD assessment. I don't see functional impairment because, you have good grades. And so then the person's even less likely to get their ADHD diagnosed, like, because they are like overperforming, they're burning themselves out, they are working so hard to to compensate and mask and whatever. And then on top of that, they're getting invalidated and not getting the diagnosis because they're working so hard to hide those characteristics. So
Yeah.
see that
No, that makes sense.
a lot of folks like kind of really bright, kind of high IQ folks with ADHD, especially where they're not getting diagnosed until like the demands just increase and increase and increase and increase to a level where Like somebody who doesn't have ADHD is able to just, like they can still do it. But the person who was spending twice as much time as everybody else at an earlier stage of their education or something, when the demands weren't that high, suddenly can't do it anymore because the demands are too high. And then the wheels come off and they sometimes get accurately diagnosed, and sometimes they just have a mental health crisis and they're still not getting accurately diagnosed because their history doesn't look like we expect it to with somebody who has executive functioning challenges.
Yeah. Damn. Yeah, there's like so much overlap. Okay. Also, how long do I have you for? I should have checked before I started. Oh, great. That's the best answer. Okay. All right, I'm going to move on to some practical advice, and then we're going to go to advocacy, and then we're going to go to looking forward. So, just for managing daily life, right? What are some tools or strategies neurodivergent individuals can use to stay organized and reduce overwhelm?
Mhm. Yeah, so I think adjusting kind of our lives to fit our neurotypes, like choosing to the extent we can, having jobs that are a good fit for our neurotype is really important. Um, you know, uh, Dr. Hallowell of the Driven to Distraction books, um, I think says like right job, right relationship are like key to good lives with ADHD. But I think surrounding ourselves with people who are understanding and supporting of our neurotype, and to some extent having people who are sort of complementary, like if you have a relationship with the neither people can do certain critical things, you might end up having to have certain support to sort of outsource those types of things, like how like with ADHD, like house cleaning or organization, like hiring an organizer or accounting type stuff that is like a comment or putting things on auto pay. But it can be really challenging if it's hard for both people to do those things. I think, yeah, so kind of having, and then also having people in our lives, though, who are very like affirming of our differences. Like a lot of times, autistic folks will have been given a hard time or they'll get down themselves about, I want to have relationships. I need to be able to just go to a bar and like talk to people or schmooze in these typical situations. And actually, a lot of times it's more successful to say, well, what are your intense interests? Like, can you find a club or something related to those where you can like have a really fun time info dumping back and forth and talking about the stuff you're all interested in, rather than trying to force yourself to like fit into you know, this little sort of typical, space that doesn't fit you. So I think just like being willing for our lives to look a little bit different than typical can be, a way to sort of help with these things. And then of course there's unfortunately a certain amount of privilege involved with being able to hire help with things that are hard for us. But I think really kind of if we can get help with the things that are most difficult, that can be really, really supportive. I think it can be perfectly appropriate for, if an autistic person is getting, negative feedback about the tone of their emails or things like that, to kind of have like a wing person who can kind of be like, hey, could you help me like read through this? Is there anything that you think might not land well? I mean, it's unfortunate that we have to do that, but at times that might be, a reasonable accommodation, to be able, if we have to communicate in those ways with people who might misread things. I think that's a good point, a good point to mention, which it hasn't come up yet, but what we call the double empathy problem. Is that something you're familiar with?
Mm-mm.
So around 2012, I think Damian Milton came up with this idea that actually autistic people do not have deficits in communication. They have differences in communication relative to non-autistic people, almost as though they're speaking different languages or maybe different dialects of the same language, might be even more accurate. And so Crompton and colleagues have since done some really interesting studies where they showed that actually So that basically what they did is they had people play kind of a game of telephone, transmitting information,
Hmm.
and they had like an autistic group, a non-autistic group, and then a mixed group of people. And what you would think if autistic people had deficits in communication was the all autistic group would do worst, the mixed group would do in the middle because they have like non-autistic people to help them communicate, and then the non-autistic group would do the best. But actually, what they found, consistent with the double empathy problem, is that the mixed group was the only group that had difficulties in communication. The other two groups actually did the same, the all autistic group and the all non-autistic group. So the idea of the double empathy problem is that we actually have differing communication styles, not that autistic people have deficits per se.
Mm.
I think it's a really important perspective because it should not all be on autistic people to totally change their communication style to accommodate non-autistic people. There's also an aspect of non-autistic people have more power and are more prevalent. So, I think it's okay for us to like as autistic people to like maybe learn a little neurotypical weirdness as a foreign language. But it shouldn't be like that's the correct way to communicate and the autistic way is the wrong way to communicate. And I think that's where like things like social skills training really falls short because they present the non-autistic way of communicating as the correct way,
Hmm.
right? But that also means in terms of coming back to your question about how do we structure our lives so that we have thrive more is if we have other people of a similar neurotype in our lives and we all like communicate in a similar way, that can make things way easier compared to trying to just force ourselves to fit into like neurotypical social expectations.
Yeah. Challenging. Oh my goodness. Because as you were talking too, I have some like anecdotal evidence in my head of people who kind of meet this criteria of what we're talking about. And even I'm having a hard time not pathologizing the behavior and like trying to find to use like a DBT word, like the middle path. Because so much of the behavior I have in my head is pathologized, right? Because of just like the quicker we can get to a diagnosis, the quicker we can get to a behavior plan, and then blah 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 blah. You're in that world. Specifically, I'm thinking of two two women who had easier time creating and fostering relationships with men throughout elementary, middle school, and high school
That is a
than
typical difference, actually. Yeah.
and not only an easier time, but like genuinely, we're talking about mean girls, like genuine struggles with same-sex relationships.
Yeah.
Like,
Hmm.
so yeah, that my radar kind of went up when you were talking about that. It was like, interesting. That would make so much more sense about X, Y, and Z. Okay, cool, cool, cool. I'm gonna.
And again, I don't want to overgeneralize, but boys do tend to communicate in a more direct, straightforward way that can be much more friendly to a um, autistic female brain. Yeah.
Yeah. And then actually, before we go forward, we've touched on it a little bit. There is, I know there's a community of autistic people who have come out in the last 5 years, especially, to say that ABA and early intervention is abuse or abusive adjacent. How do we, and what is the role of early intervention with autism that can be done in a respectful way that is still effective? And is that needed, or should we do kind of what we're talking about here, which is change the general culture around how we are experiencing autistic people?
I think early awareness and accommodation is excellent. Early intervention, like ABA, that is trying to basically conversion therapy autistic people into being neurotypical is a problem, right?
Yeah.
And I would say the biggest problem with ABA is that the goal is typically, it was developed by the way, by the same guy who developed gay conversion therapy. Lovas,
What?
yep, same developer.
What?
Yes.
Hold the fucking door one second. Sorry. Say that for me one more time. What was his name?
Ivar Lovas. Developed both ABA and conversion therapy.
Oh my gosh. Very dark sense of humor happening over here because one of my very dear friends recently got an autistic diagnosis in the last 2 years. And they also, in the last 5 years, came out as gay.
Mhm.
And we both grew up going to religious schools and we both worked ABA. So like we've had like a very
Mhm.
intense reflection time of like, wow, wow. And like there was a lot of grief over thinking about the interventions or the interventions that we implemented. And her and I have had extensive conversations over just having to ignore our gut feeling of like this just doesn't feel right. This I feel like I'm harming this child in the name of behavioral change. Like how much we would have to ignore our gut instincts to do the intervention, keeping in mind that most people don't realize that most of those quote unquote behavioral techs just need a high school diploma to show up, right? Like
Right.
that blew my mind the most was that these parents were being led to believe that I was this qualified behavior specialist when in reality I had had 3 weeks of training and was like still learning many, many things as I was going, right? Like my success, if we're going to call it, with kids who are autistic was because of my relationship to them, like building
Mhm.
rapport with them, helping them build relationships with their friends, just being somebody they could come to for just about anything. Like that
Right.
was way more impactful than forcing them to raise their hand a certain way, essentially, and then like
Yeah.
rewarding that behavior. So,
Yeah.
yeah, this is
Yeah. Yeah.
frustrating.
I put a link in a chat to a paper about ABA and conversion therapy.
That's blowing
Um,
my mind, Amara. That's blowing my fucking mind.
But the thing is, if we know like that a young child, we're like, oh, yes, they have an autistic neurotype. Okay, what do they need in terms of communication, right? And this is not to say that it should, I mean, autistic people, of course, we can learn things and we want to help people learn and grow as much as they can and they want to, right? But the other thing is a lot of kids especially, and I think this is a general problem in child therapy, very often children are in therapy to make them more acceptable to adults, right?
Ouch.
And of
Yeah, that's
course,
so
children
true.
are all learning, so are learning to learn and grow. But at the same time, we need to be collaborating with the child. We need to know and validate what the child wants, right? And ABA is turned into by saying ABA is problematic, I'm not saying that that all behavioral based interventions are problematic.
Hmm.
There can be behavioral based interventions that are implemented with full consent and collaboration in an affirming way and where the goals are appropriate to the child or the other the adult's needs. There's aspect of that with DBT, for example. There's aspects of that with the an anxiety therapy called the supportive program for anxious childhood emotions. And so I think if the behavior intervention is done, with collaboration and consent and and with kind of autonomy supporting and affirming goals, then it's not necessarily problematic, but that's not how ABA is typically done. It's a giant industry and it typically has been focused on and also social skills training have both been focused on, making autistic people look more non-autistic. And in fact, a goal has been literally making them indistinguishable from their neurotypical peers. Talk about not diversity affirming, right?
Yeah.
So yeah, how can we help people like learn and grow in the way that they want to? That's a whole different story. Yeah, but early support, I mean, autistic folks can benefit from not all depending on their needs, but for sensory differences, working with a knowledgeable occupational therapist from an early age to help figure out what are their sensory needs, how can we accommodate those, how can we provide support so that their sensory needs are met and they're not dysregulated due to those needs not being met. If they're, stemming and or trying to get sensory input in a way that is, straight up unhealthy, then is there another way that we can give them that, is healthier and still gets their needs met? But notice underlying this is still gets their needs met, right?
Yeah. Yeah.
And then, we also really want to intervene, I think, at a systemic level. There's some really great programs. There's one developed by University of Edinburgh called Learning About Neurodiversity at School, or LEANS, to kind of help the school staff and other students understand and respect diversity, rather than just trying to make the autistic child look like a neurotypical child. Similarly, Awesome Training, which is based in Ireland, it's AUSOME training, has a program called the Thrive program. I'm not quite sure how it's different from Leans, but they both have the same kind of goal of kind of educating the environment, helping parents learn about the autistic child's needs and how to accommodate those things, so that the child can participate in more things. Maybe they can do fun things if they have like ear protectors, for example, or, maybe they can focus better in class if they are allowed to STEM, to move around or to use certain STEMming tools as they need to. And yeah.
I love that. My mind's still spinning over that fact that you just shared with me, but I will let it spin in the background. My next question is, how can neurodivergent individuals balance the need for rest with the often drive to pursue their passions or goals?
That is a hard that is a hard one. And I say that as somebody who frequently wears myself out. Diving into those things. It's interesting. I think that there's a number of different answers to that. I think, one is sleep is really important for many of us, and kind of having some guardrails around sleep. For some people who are sensitive to sleep deprivation, I'm definitely one of those people. Kind of having sleep routines, approaches like cognitive behavior therapy for insomnia, which is basically a just really efficient kind of sleep therapy, can be helpful. Many ADHDers and autistic folks have challenges kind of turning our brains off in order to be able to sleep. And so, yeah, so I think sleep is an important one. I think, but in terms of not being burning ourselves out, so one is masking is a huge risk to burning ourselves out. So the more that we can be able to unmask and be safe doing that, the less likely we're to burn ourselves out. In terms of passionately pursuing our interests, I think one is we can kind of like have the guardrails like around sleep to sort of like make sure that we're not wearing ourselves out. Many of us are energized by pursuing our interests, and many of our brains work better. This is true for both autistics and ADHDers in like a deep, kind of in a deep dive. So we may be better off just sort of deep diving and kind of doing a big thing, like, all in a big bunch. So one is kind of organizing our lives to allow that. If I know that I'm going to, write an article better, if I set aside the whole day to write it, or if I set aside at least several hours at a time, then I can organize my time that way rather than not organizing my time that way and then kind of scrambling to get the space that I need to focus. Um, Another is to set aside recovery time. Like if I know that I'm going to want to do some things, like travel is a common one that people find very exhausting, or I know I'm going to want to do some kind of social thing like conventions. Like a lot of autistic people like really love going to conventions that are related to their intense interests. As you probably heard, Comic Cons, Fur Cons, like, sci-fi conventions, whatever. I know those are stereotypical, but it could really be any, a psychology convention, right? For those who are passionately interested in that. To give ourselves recovery time, like don't go to do that and then expect ourselves to just wake up the next day and be back to the usual routine, right? Like we might need some really intentional, pre-planned downtime in order to, or time just leaning into and doing the things that we love at a more mellow pace, to be, or doing some soothing repetitive behaviors, to be able to then get back to typical daily functioning. So I know that's a hard thing to do, but I think that that can be another solution that allows you to do the intense, to get into the intense interest without without then having a big struggle afterwards.
Yeah, no,
And
that
then
that
people do find their interests also very energizing. It's just we can end up like kind of overdrawing our tank and then just being like really exhausted.
totally. Like that is a really cool thing you're writing, and sleep is good. So go to sleep.
Right?
I love that. I love that. Moving into mental health and just overall well-being. How does the intersection of autism and ADHD and gender affect mental health outcomes such as anxiety or depression? We've talked about this a little bit with missing the diagnosis or overemphasizing like an incorrect diagnosis, and then of course myths about autism, right? We've touched on this. Speaking specifically to it though, what is that intersection of gender, neurodiversity that can cause those mental
Yeah,
health
so
outcomes?
I think again it's not real clear why, like for example, women do have higher levels of depression and anxiety, but it's not clear, is that because of some kind of any kind of biological differences, or is that because of, that sort of social model of disability? Like for example, many, girls are more socialized to, fit in socially more and be socially savvy more. Are we anxious and depressed because that's a difficult thing to do in certain social contexts? We're socialized to like not take up space and not, that which can get in the way of advocacy in terms of getting our needs met. Um, I think there's a lot, boys are unfortunately often socialized not to be aware of or show their emotions. And so there's a lot of like socialization sort of reasons for those differences, as well as perhaps sometimes like some hormonal reasons and things like that, if we're talking about, peri and postpartum depression and anxiety, or even like, premenstrual dysphoric disorder or things like that. I would also say there's a definitely non-trivial overlap between gender nonconformity and also other LGBTQ identities and autism. And so, unfortunately, that adds to there's an intersectionality in terms of like stigma and so forth in many communities. And that can definitely contribute to those, difficulties as well. And,
Yeah.
adult women, unfortunately, are still expected to do more of the housework and child rearing and things like that, even while they're often also, pursuing their career interests and stuff. So that can certainly contribute to the strain and stress on adult women.
Yeah, totally. No, that makes perfect sense, and it again leads perfectly into that next question, which is how can someone cultivate self-compassion when struggling with something like executive dysfunction or other challenges?
Yeah, that's such a good question, right? I think it does, at least for me, the kind of social model of disability approach is somewhat helpful with that, realizing that this is not an inherent deficit in yourself. This is, kind of an interface with what society is expecting, and it is somewhat arbitrary. And to just really validate that that's not your fault, that that's the way that society is organized. To kind of ask for and receive help in terms of the things that are most difficult, I think can be really helpful, not just practically, but also like in asking for and receiving help, in telling somebody else what you need. That is somewhat opposite action to shame in DBT parlance, right? We're saying like, okay, I don't actually, I don't actually need to feel ashamed about this. I actually can ask for help. We want to make sure that we're asking people who are actually going to be helpful and not invalidating, because if people are invalidating, that could make things even worse. But yeah, so I think that, and just, giving ourselves permission to adjust our lives and use tools in a way that is that's helpful to us.
Yeah.
Yeah. And then of course there's the role of the people around us, which is incredibly essential, right? Like people around us can either, say what's wrong with you and give us a hard time, or they can, you know, kind of be accepting and validating. And that makes an absolute world of difference in terms of the emotional impact of those differences.
Yeah, totally. I 100% agree, right? Like who's in your circle is definitely going to affect how you see yourself, how you see the world. Definitely that self-compassion. If people outside of you are critical, it's hard to also fight the critical voice inside your head, double front.
Totally.
Okay, moving on to advocacy and systemic change, which first question for that would be, what are some effective ways for educators to create inclusive classrooms for neurodivergent students?
That is a great question. So I think, having an ability to kind of stem and meet sensory needs is a really important one. And in fact, it can even be more validating to just, if possible, kind of provide those resources and tools, to everyone. Like, let's make ear protectors, let's make, STEM toys, let's make things like that, if possible, available to anybody who needs it. First of all, that helps reduce the sort of inequities in terms of like only some kids are identified and only the kids who are identified are allowed to do this thing and whatever. Sometimes that's not possible, but I think that providing those sensory accommodations and providing them in kind of this is aligned with kind of a universal design for learning. Like, let's give everyone things in writing. Let's have subtitles when there's things like on a screen, that kind of thing can actually really reduce stigma because you're not the only, like a lot of kids don't want to use the accommodations that even if they're allowed to because they don't want to, stand out and be given a hard time about it. So I think that's something, really important. Teachers can be super validating and like, oh, well, what is it that you need? Now I know teachers are like, like lots of other people, very overworked and short on time and stuff like that. But actually, validation often doesn't take more time. It just takes a different approach. So we can definitely do that. Teachers can educate about neurodiversity. I know this is probably loaded in some areas these days. Diversity of any kind is unfortunately kind of a controversial topic in some circles and areas, but can educate that people have different brains. And, I don't think you even have to use any kind of language that would be questionable to do that education about neurodiversity, that, hey, some people learn differently and that it's valid that they need that. Also, that every kid does not have to have access to something for it to be okay for one kid to have it, right? So, that's gets used sometimes and as an excuse. I can't let this kid do that because then every kid would want to do it, and well, not every kid has the same needs, so let's not use that as a reason not to do it. I think letting kids connect their academic work to their areas of intense interest is actually a really helpful one for increasing interest and attention in ADHDers, and for definitely helping for autistic kiddos. Like, if they have to write an essay, unless the topic of the essay is critical, let them write their essay about something that interests them. It's going to be like way easier, let them do math problems related to something that interests them. That is going to be really helpful. I think also really importantly, not pathologizing communication styles that the kid can't do anything about, like, or needs for, sensory accommodation. Like, everybody does not have to sit crisscross applesauce. Everyone does not have to be silent at all times. Everyone does not have to make eye contact with the teacher to show that they're paying attention. Some kids can pay attention better if they're not making eye contact with the teacher. So let's just be flexible in terms of like what we, expect kids to be doing in the classroom. And recognize that certain disabilities like, dyslexia, dysgraphia, and all of those are, as well as autism and ADHD, are very valid differences. And please, please don't accuse the kid of not trying when they are, trying extremely hard. I will also just make a shout out for we haven't talked about this at all, but for kids who have challenge who have a really high need for autonomy or other kids who need a really collaborative approach, I'm a huge fan of Ross Green's collaborative and proactive solutions, otherwise known as collaborative problem solving. He is author of The Explosive Child, Raising Human Beings, Lost at School, and he has a really collaborative approach to intervening regarding behavior concerns with children. This is also, by the way, in my opinion, a great alternative to ABA in many cases. And he has got tons of training resources, including a lot of training resources for schools. And there are schools and school districts that have adopted his approach to great benefit. It is very collaborative. It does take the autonomy of children seriously. So for some adults who are kind of stuck in a bit of an authoritarian toward children kind of mindset, it can be a shift of mind, but it can also be an incredible way to make things go better with neurodivergent children and also to help meet their needs because part of it is communicating with the child about what's getting in the way of them doing whatever it is that the teacher or the school asks them to do, but in a way that's not like, what's wrong with you that you're not doing this?
Hmm.
It's like, oh, everybody else is walking to the flagpole and you're standing here. What's up? Right? It's just very kind of curious and respectful. And I'm a huge fan of that approach. So.
Yeah, I love that. I'm a huge fan. I had not even heard of that, and I love that. That's so great. And you're
Uh-huh.
so it's so accurate to say that there are unfortunately still a vast majority of adult figures who are basically trying to force a child to be an adult, right, behaviorally, right, instead of meeting the child where they're at. I often think about the fact that
Worse. Oh my gosh, schools are so much more restrictive than the amount of freedom that many adults have in day-to-day life. Like you have 4 minutes to get from classroom to classroom. If you need to go to the bathroom, you need to grab something from your locker, too bad. You're going to be late. We're going to come down on you. You need to go to the bathroom. No, you can't go to the bathroom when you need to. I mean, I think the schools are way more restrictive than actually like adult life in many cases. And
yeah,
it have to be
yeah.
that way.
Yeah, there's a scene from the movie Slumberland, and the child is asking, I don't know if you've seen that movie, but the child's asking about school, and the teacher, I can't think of the actor's name, who's walking her through giving her a tour, is describing it, and she's like, so this is basically prison. And he's like, no, 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 no. She's like, so I can leave whenever I want. He's like, also, no. She's so it's like prison. He's like, it's a little like prison.
Or even go to the bathroom when I need to, or even
Yeah,
move
yeah,
around, or fiddle with a pen, or like do what I mean.
yeah,
Yeah, no, unfortunately, it's often very, very restrictive, and I think that's a whole broader question. But there's a lot of kids for whom, a one size fits all, trying to get every kid to conform to a particular norm educational system is a poor fit. Like it's
yeah.
it's a poor fit for kids who learn at a different pace, whether that's faster or slower. It's, a poor fit for kids who need a different format for certain things. And I think that's one place where I would love to see more um, of a place of like technology, for example, and helping, and that's not the full story, of course, but like, and just more flexibility. Like, why does every kid have to do everything the same way?
Yeah.
And, there's a lot of battles around I mean, just the amount of stress and battles around special ed accommodations, even 50 like IEP or 504 processes, that if the whole system was just a little bit flexible, more flexible, a lot of that would be much less of a battle. Yeah.
Yeah.
Um,
Yeah. No, totally. Yeah. I'm hearing the rigidity, and like I've worked in schools, and so I've experienced that
mhm.
frustration. And the teachers who I had more success with were less following a specific protocol and more just like we're a good fit for the kid I was working with, right? Like I worked with one kid who really needed structure. Like he actually responded quite well to a little bit of rigidity just because he
Yep.
was very focused. And if there was a boundary, he was actually very good at honoring that boundary. But if there wasn't, he was like, the fence is open, whatever the hell I want to do, I'm going to go for it. And the year
Mhm.
before, he had a very flexible teacher. And, on the one hand, you're like, oh, flexibility. What a great asset. Not good for this one particular student. The very next year, a lot of his behaviors changed because this teacher was so good at being consistent with some of the what we would call rigid, but what was actually ended up being very structural for him. So yeah, I
Yeah,
hear you. I hear like there needs to be more flexibility on like what is needed for the child versus like what's a good fit for the school,
right.
which is definitely
Yeah.
not the way it currently is.
Yeah.
Um,
I would also say you said one thing a little while ago that I wanted to come back to with that. So you mentioned that you had worked in ABA, and a lot of people who are interested in helping and working with autistic children get their start working for ABA companies because unfortunately ABA gets way more funding than anything else. And also they hire lots of well-meaning college students and young adults to do that work who don't realize that it's, not, a helpful thing to be doing until they did it, perhaps when they've done it for a while.
mhm.
Um, but I would really encourage folks who are interested in that, like consider other ways that you can get involved. Like there is a desperate need for people who do more affirming approaches for autistic kids, who do, validating types of therapy. In fact, one of the things that I just want to blow up this idea that ABA is the thing that has all the data behind it. That is
That's all I
not.
was told. That's all I was told over and over again. It's like this is the most data-driven, most successfully data-driven approach.
No, there was actually a meta-analysis a few years ago that showed that a lot of the data behind ABA were like very poorly designed, very small studies. And that when you looked at the quality of the studies involved, that ABA did not have better evidence than other approaches. And it's not even including the data on, autistic people who went through ABA having been traumatized by that. But yeah, I'd say there's a desperate need for people who, I struggle to find people to refer to who know Ross Green's collaborative and proactive solutions really well. I have no problem if I wanted to refer to ABA, I got infinite number of providers for that, but collaborative and proactive solutions, few, right? Things like Ought Play, like a really affirming form of therapy, floor time, which is another really affirming form of therapy, speech supports to help kids who need some speech, other ways to communicate. All of that there needs to be way more of. So there's plenty of ways that people can, get involved in supporting autistic kids in an affirming way, and we desperately need more people doing those things. So.
Any organizations that we could highlight? Like I'm in California. Are there any, there's a shit ton of ABA organizations here. Are there any affirming? Because part of the reason I got brought in was I was recruited because I worked at a day program for adults with developmental disabilities. Loved it. I actually loved doing that job. It was just, it paid so terribly. There was no way I could live in
Mhm.
California and maintain it. And the gentleman who recruited me, he said, "Hey, I do ABA. You'll make double and it's a lot less work." It wasn't
Mhm.
less work because kids, I would argue, are probably 10x more work. Adults are way more chill. It was double the pay though, like
Mhm.
immediately, which felt odd, but yeah.
Right. I think one of the challenges, there's a lot of training resources for those approaches, but unfortunately, there's not necessarily. I'm trying to think of like big companies. There are group practices that are doing those approaches, but it's not a giant industry
Mm.
like ABA. So I think there's not yet where I could say there's this one giant company
Yeah.
that does neurodiversity affirming therapy. And partly that's because of the misreputation of being the thing that has all the data behind it.
Yeah.
ABA is been sort of institutionalized in terms of policy, in terms of getting tons of funding
Yep.
and things like that in a way that's allowed it. And I think it's probably been unfortunate for it in some ways to turn into this giant industry.
Yeah.
But I would say there are certainly plenty of opportunities that people want to have, like, if they get, some kind of appropriate credential, they want to have a private practice. There's a lot of group practices that are doing their affirming things. There are, a lot of, yeah, so there's a lot of opportunity, but it's not quite as, the kind of you look on Indeed and you find people listing a bunch of jobs in that area.
Right. Yeah. Dang it. Okay, I do have policy questions for you, but they're not yet. So, but you led me into the other questions first, which are about therapy. My friend who started their own practice has a very, very, very amazing like neurodivergent affirming setup.
Awesome.
Because she is neurodivergent herself, she's autistic herself, so she has like firsthand experience of what works and what doesn't work in the therapeutic setting. So my question is, how can therapists adapt their communication styles to better align with neurodivergent clients' preferences?
Mhm. Yeah, so well, I think communication is only one of the things. Can I explain like a little model that we came up with
Please.
how to tailor? So that we came up with this in the context of how to tailor DBT for autistic clients, but I think it's actually relevant to a lot of different kinds of therapy based on how autistic people are different. So we call it the ascent model, like if you were ascending a mountain, because we're kind of helping people ascend toward their goals. And so the A is for autonomy. So it's basically related to goal setting for autonomy, supporting and affirming goals. So we want to make sure that we are collaborating with the client to figure out what they want and to set the goals for therapy based on what they want, right? So that's autonomy supporting, and we don't want to be endorsing goals that are like conversion therapy, right? We
Right.
want our goals to be, things that are supporting their neurodivergence and obviously, informed by what they want, right? So that's the A for autonomy and supporting and affirming goals. And then the S is for sensory differences, stemming, special interests, and need for structure or routine. So we want to consider all of those autistic differences in terms of how we run our therapy practices, right? So we want to make sure that we're providing opportunities for people to accommodate their sensory needs. Do they need to move around? Do they need to stem in certain way? Do they need to rock or stem in some other way? Have fidget toys and things universally available to people, have heavy things that they can, put over themselves if they need heavy pressure, allow people to move around without being stigmatized in any way. Um, have ear protection available for, headphones, for example, for clients. And just generally like consider, needing to meet their sensory needs and their need for stemming. Um, have connect therapy to their special interests if possible, like obviously encourage them to share about those things, but also if you're teaching some sort of, emotion regulation skills or something, consider connecting that to their interests. Um, Definitely for structure, kind of collaborate, like you pointed out rightly so that autistic clients have different amounts of need for structure. So, some clients may want to come in and start their sessions in a particular way, and other ones may come in and like, they want to just, maybe they like want a written agenda or they want like a lot of structure in their process. So like consider what their need for structure is. That might inform the type of therapy in general because some forms of therapy are more structured, but just sort of consider that need for structure and routine. Okay, so we've got the A and the S. The C is for communication. I'll come back to communication differences in a minute, but we definitely want to be accommodating those. We want to be provide the E is for executive functioning support because actually a lot of autistic folks have pretty significant executive functioning differences. In fact, it's a very high overlap, like at least estimates 80-ish% of autistic folks also meet criteria for at least inattentive ADHD. So we want to make sure we're providing those kinds of organization planning reminders, things in writing, places to find stuff, executive functioning support. The N is for neurohumility, which is a term that my colleague Rachel Kraus came up with. That's basically just kind of knowing what you don't know and being humble about what you don't know about the other person's brain and needs and being really open and curious to find out. And then the T is for trauma informed, like being aware that lots of autistic people and ADHDers have very extensive histories of chronic invalidation trauma, where because of living in this world that's not a good fit for us, we've been told that we are, kind of wrong in a variety of ways. And just being aware of that, being aware of the, rejection sensitivity that many of us have. A lot of people come into even a therapy process masking because they're like afraid of their therapists rejecting them because they've been, rejected in so many places in the past, right? So really creating that curious open space, right? So that's the ascent kind of model to remember all that stuff. In terms of communication in particular, I would say be direct. Don't rely on subtle kind of hint dropping communication. Many autistic folks are like, we might have an idea you're trying to say something, but we have no idea really what it means. Like, just say what you mean, like, not rather than sort of giving a subtle hint. Visual supports are helpful for a lot of folks. Some autistic people do much better with having like, memes, graphs, like infographics, like generally kind of visual supports for the ideas that we're trying to communicate. Have spoken communication options. So you might have like a whiteboard or a chalkboard, although those can have smell and dust issues, but like, or like a big paper pad where you like write on to communicate, and give the client the option to use those means of communication as well. Some people communicate like with the online formats through the chat, through like sharing memes, things like that. So don't just sort of accept that just blah blah spoken communication back and forth is the norm, right? That is the case in many therapy settings, and that's also not affirming for many autistic people. Um, I really, another really important one is don't try to interpret autistic nonverbal communication based on non-autistic norms. So that means if you think the person's voice sounds angry, don't assume that that's what that means. Or they're kind of, their facial expression is kind of flat. Don't assume they're not feeling anything. Like, be curious and be open, but we can really kind of have miscommunication by interpreting they're not, or they're looking away, so we think they're not like interested in it or whatever. We really don't want to try to interpret autistic nonverbal communication according to non-autistic norms, because that's likely to really lead us sideways. um, we don't want to rely on autistic clients understanding our nonverbal communication in a neurotypical way. For example, sometimes therapists will say, "Oh, I'm going to lean in to show them I'm interested," or "I'm going to like make my tone of voice really warm." I mean, that might be nice to do, and it's fine if they understand it, but also like it might just like not get received. So don't solely rely on those kind of subtle like nonverbal communication kind of differences. Um, another really important one is to allow a longer processing time before responding. A lot of autistic folks need a longer, even if they're extremely bright, like need a longer period of time to receive what you said, process it, put together what they want to say, and then respond verbally.
Hmm.
So don't just sort of expect or demand an immediate answer. If you're getting kind of a next level thing with that is if you're giving a lot of scripted, like, I don't know, or okay, or something like that, you might say, do you need a little bit more time to think about that? Because some of us will come up with like scripted answers that are kind of like, we've learned that somebody expects us to say something quickly, but then
Hmm.
you're not really getting the real information. You're just getting kind of like a filler script. Like somebody else would say, right? You might be getting yeah, or okay, or I don't know. And it's just like kind of a scripted answer. So if you feel like you're not getting a lot of information, you might consider like just saying, allowing a longer processing time. Um, and then I would say another one is welcome and answer all the questions. Like one of the types of trauma that many autistic people have is we ask a million questions about everything. And then we've gotten flack from people like teachers and parents and who just don't feel like they have time to answer all those questions, and been stigmatized for that. So really invite, all the questions that the autistic client might have and do your best to answer them. Or if you don't know the answer, you can say, be honest, just be like, "Oh, that's really interesting. I don't know the answer to that, but let me look into it," Um, And I would say the other thing is accommodate like bottom up processing. So many autistic folks tend to kind of need to know all the details before they kind of put together the big picture. ADHDers tend to start the big picture and then maybe eventually get to the details. So if you have autistic ADHDers, you might have sometimes they're at 10,000 feet and sometimes they're lost in the weeds, but kind of putting together those levels. So you might, just realize, do they need all the pieces before they can put together the big picture? Is it helpful to be like, all right, so basically putting all those things together, here's what I mean, right? So that we're not only seeing the forest or only seeing the trees, right? We're kind of like, seeing the connection. And then I would say, despite the fact that I just talked about the forest and the trees, which is a metaphor, I mean, autistic people can definitely understand metaphors if we've like learned them, but we might be more likely to just sort of communicate directly and not necessarily prefer to communicate using metaphors. Or even if we do use our own metaphors, we might not necessarily tend to just understand somebody else's metaphors in the way that they um, intended them. So just I would be careful about using a lot of metaphors.
Okay, wow. My next question was going to be, what are the common mistakes that therapists make? I think you've covered most of them. Are there any that you haven't said that you'd want to say, like common mistakes that therapists can make when dealing with or helping someone who is autistic?
Oh goodness. I think I said a lot of them. I'm trying to think of what I might not have said. I mean, I think related to the goals, like one of the biggest things is assuming like autistic people are commonly referred to therapy with the assumption that they want to they want to appear less autistic, that we want to target their autism. That is not what we're trying to do in neurodiversity affirming therapy. So I would say even if the client comes in, and they're saying, I want to make better eye contact, you can say, well, interesting. Okay, tell me more about that. And then it turns out that like the psychological assessor told them that they have poor eye contact and that really the reason they want to make better eye contact is they want to like have more friends, right? So we want to just sort of like really explore with them what their goals are and just of course if they really want them like okay, I want to understand how to do a certain thing better, then we can help them learn how to do that. I'm not going to refuse to do that, but we want to kind of explore that and kind of try to help discern like what their underlying goals are. So I think just really like not assuming, like a lot of times people say, I need a therapist for an autistic client. I'll be like, for what? Like, what do they want to work on? Do they want to work on emotion regulation? Do they want to work on acceptance of their autistic neurotype? Do they want to work on making more friends? Like, what are the goals? Let's not assume that changing anything about their autism is the goal.
Yeah.
And yeah, I think I spoke to a lot of the other common mistakes.
Hmm.
I think not recognizing that executive functioning differences are part of autism because they are in fact not in the diagnostic criteria for autism. So a lot of people don't realize that that is very likely to be the case, that there will be some kind of executive functioning differences. I think that's a really important one, to kind of recognize and support. Um, yeah, and not realizing things like the voice tone, again, then not interpreting autistic nonverbal communication. And like I will often see, even in like DBT, which is supposed to be a very validating form of therapy. I mean, validation is a central thing in DBT, but I'll see people asking questions and, interpreting an autistic client doing something to try to get their needs met as being
Willful.
resistance or like willfulness.
Yeah.
Yes, it's a very common one. Therapy interfering behavior, rather than just kind of validating it as a way that they're trying to get their needs met and trying to like work with them. I mean, of course, we're not saying that the therapist doesn't get to have their needs as well. Like, I mean, of course, it's a relationship between, therapy is a relationship between people. But let's work collaboratively and really validate the autistic client's needs rather than assuming that they're kind of doing them for no reason. And I guess I find that especially striking because DBT, we are very much about explicitly, let's figure out why things are happening and let's assume people are doing their best. So if we are accidentally doing that as DBT therapists, then probably lots of other therapists are doing that as well, right? Like, yeah. So,
Yeah, totally. Amazing. Okay, now for the fun part, looking forward, looking ahead, so systemic and policy level
mhm.
changes. What policies or initiatives should corporations adopt to better support neurodivergent employees?
Oh gosh, there's a lot. So I think one is having differences in the hiring process. That's often where people have focused on, accommodations in the past. So for example, interviewing is really hard for a lot of autistic folks in terms of like typical interview norms, that rapid fire back and back, not back and forth, not knowing what to expect, knowing what this kind of hidden norm in terms of how things are supposed to be framed in an interview. And there's a lot of evidence that those kinds of interview processes aren't very predictive of performance as an employee anyways. So kind of changing those processes to give like more predictability and structure, less reliant on just verbal communication, more directness, stuff like that, really helpful. And then I think in the workplace, I mentioned before, not penalizing autistic nonverbal differences or other aspects of autistic communication. If there's something that is mission critical in terms of people understanding each other, then let's figure out, how can we help get that communication to be more accurate. But let's not do that in a way that assumes that the neurotypical norm of communication is the correct way or something. In fact, direct communication can be a real strength for autistic employees if other people are not misinterpreting that as rudeness or something. I think obviously really validating need for accommodations and not, I mean, I just can't even tell you the number of times that autistic employees get feedback that's basically like, it's not, you need to be less autistic, but it really is because the things that they're getting feedback about are things that are like autistic differences that are not even like interfering with them being able to do their job. It more tends to more have an effect on um, maybe relationships with neurotypical coworkers who have certain non-job related expectations of social schmoozing and certain stuff, or relationships with bosses sometimes where there's an unexpected kind of communication. So I think certainly not penalizing people for their autistic characteristics, which by the way is the law. I mean, you're not supposed to discriminate based on a disability. Just a lot of employers don't realize that what they're saying is discriminating based on a disability. And then providing, like in the therapy process, supports for all those things that we were, talking about, communication, executive function, sensory stimming, structure, and so forth. Yeah.
Yeah. Yes, so practical. I love it. And yeah, very, very attainable. None of those things are moving mountains. It's very systemically achievable. Next question is, how can allies advocate for systemic change that better serve the neurodivergent community, both locally and nationally?
Yeah, well, I think people can certainly advocate for change in the organizations and families and schools and so forth that they're already a part of. I think hearing from allies is really important because otherwise it's often assumed that ableist neurotypical way of doing things is the correct way and that everybody thinks that. And so if you don't have allies supporting neurodivergent affirming approaches, speaking up, then it maintains that misassumption that the neurotypical way is the correct way. Um, and I think really like highlighting where, of course, we don't want to out somebody based on anything that's private to them if they didn't consent to it, but we can really highlight, wow, I'm really impressed by so and so, caught this mistake in this coding that like nobody else caught, or something like that's really kind of highlighting some of the um, autistic strengths in the workplace. And autistic folks have a lot of like incredible strengths like in the workplace. You wouldn't know about them if you read some of the literature because it like frames those things often as bad things rather than good things. So I'll give you an example. There was a study, which I might not be remembering all the details of, but it basically showed that when given an opportunity to do something that was with that other people wouldn't know about, would people other people would or wouldn't know about, that was self-interested. Neurotypical people would act like they would be sort of ethical, basically act like for the good of the group if other people would know. But if it was private, they would basically do whatever was in their own interest and not what was in the interest of the group. And the autistic people would do what was in the interest of other people, regardless of whether or not other people knew about it. And that was interpreted as autistic people having a deficit in understanding how social norms operate. Like I was like, wait, but if I was an employer and I have people like, I don't know, counting money or like doing any number of other things, wouldn't I want the people who I can trust to do the right thing?
Yeah. Yeah. You'd think. I mean, that makes sense.
So, there's I think that yeah, we just really want to like recognize that it is worth providing some accommodations and being tolerant in order to have like, people whose brains work differently, and that can be an advantage. And this is not to buy into the sort of autistic people have superpowers. We just need to, leverage their superpowers, but there are benefits to the ways that our brain operates. And those could be um, highlighted and validated, or they could really not, and to the loss of both the autistic person and the organization. Um, yeah.
Yeah. And that leads right into the next question, which is what advice would you give to someone who wants to push for systemic change and how neurodivergence is treated within the organization?
That's a good question because it kind of depends on like where they are in the organization.
Yeah.
Honestly, I think if somebody, is not in much of a position of power, they're just like another maybe similar level employee. I think honestly, being doing whatever they can do to be affirming within their role, I think is, most important. So first of all, they can be inclusive and friendly and affirming to the autistic employee, which is, helpful. If they see something being misinterpreted, they can kind of gently raise that. Like, for example, I once was in a situation where people were criticizing a trainee based on, in my view, their divergence from expected gender norms. This had nothing to do with neurodivergence. I was not in a position of super high power, but I was in a meeting and I said something like, do you think it's possible that the fact that the way that they are operating is different than what is typically expected for a trainee of their gender and race could have anything to do with how we're interpreting this? And people were like, oh my goodness, like, so uh yeah, I mean, people were kind of, I mean, I stated it in a way that was pretty, kind of curious. And I think if we just go around saying, you're all a bunch of ableist jerks, like most people are going to go into defensive mode. But we can, speak up in whatever part of the system that we're in. I think it's a different story for leadership where they might be able to actually do a bit more. But, wherever we are, not just being silent and leaving it all on the whatever the diverse population is, to be honest. But in this case, the autistic person to do all the advocacy, right? Like we can speak up when we see something that doesn't, seem right.
Yeah. Amazing. Amazing. I have one last totally potentially random question I don't want to forget to ask that a good friend of mine texted me. And then after that, I'm going to pass the mic to you. And if there's no questions, then we'll wrap it up. Uh, they asked, I think one thing I'd ask is how to separate true, long-term wants and desires from temporary hyperfixations. In a world where things are more expensive than ever and we have appropriately become more and more conscious of the amount of waste we create, I find it challenging to pursue interests or new hobbies because I'm afraid I'll lose that interest just as quickly as it came.
I'm so sympathetic to that as an ADHDer. Now, I will say this is not universal, but autistic folks do tend to often, if they're not ADHDers, do tend, which is actually probably a minority of autistic folks, but sometimes do tend to have this the same consistent interest over time, right? So it's maybe less of an issue. Although many people also like collecting stuff, so I suppose it could, relate to that. I think as an ADHDer, I'm saying this from a little bit from personal experience, but I think if you know that you're a person who is going to sort of be deeply into something and then you're going to get bored with it and want to switch to something else, which is true for for some of us. Um, I think just knowing that about yourself is very powerful. You could be like, okay, well, I'm interested in, let's say I want to start learning snowboarding again, but I'm not sure that I'm gonna, still want to do snowboarding in a few years because maybe I'll want to do ski mountaineering by then because I'll be bored with snowboarding. I don't know, I'm just thinking of random things. I live in Reno, so we have mountains here,
Yeah.
so then I might be like, you know what, maybe I'm gonna just do like a season rental on snowboarding gear rather than like buying like, I don't know, $1 bazillion worth of like snowboarding stuff. Because also I'm an ADHD and I'm not gonna get around to reselling it if I lose interest in it. So I'm really gonna like lose all that money if because this is like what I know about myself by now, right? So if I say like, well, maybe my interests are going to shift, then maybe I explore that thing in a way that's not as heavily invested. Like I don't want to assume that it's always going to be my big thing. Like I can say, hey, you know what, this feels familiar, this deep, like I want to do nothing but this right now. And like what's a way I can do that that also would be like, okay, if I decide in, a month or a year that I want to do something else. Um, so, I mean, I think just kind of knowing yourself and then kind of planning appropriately. And I think that's where, kind of come back from the DBT frame, like our kind of acceptance, like self-acceptance and really knowing ourselves deeply and kind of saying, yeah, part of like getting bored and wanting to switch to something else may be part of how my brain works. And I'm just going to kind of accept that instead of like making all my plans around this is what I'm going to do for the next 30 years.
Yeah.
One person was very inspiring to me about that. I found it frustrating at the time, but when I was in grad school, we had some really, really brilliant people in our department at Michigan, and somebody who's really, really sort of famous, amazing, brilliant scholar had done some work that was published relatively recently. But you know how academia works, like whatever was published recently, you probably did 10 years ago because of how long it takes to get stuff published.
Yeah.
And I went to him and was like, oh, I'm so fascinated by this. Like, would you be interested in doing something? And he said, oh, I'm not doing that anymore. Now I'm doing this. And like, he was, there's people who are like, there's different ways that are totally valid to like do almost anything, right? There's people in academia, they developed one theory in the 70s, and every single thing they've done since has been like some tiny tweak on that. They're brilliant technicians, everything is related to that, right? And this was somebody who's like, world famous, incredible scholar. And he would be like, nah, I'm done with that. I'm doing this other thing, which also was like earth shaking because it was amazing. But he just kind of, I mean, I don't know, but as far as I could tell, he was just kind of like, "Ah, that's how I roll. Like, it was fine. And I found that kind of inspiring because I was like, well, if he could do that, then I guess I can allow myself to like shift when things, and not apply some kind of ableist pressure that I should be doing the same thing for 30 or 40 years, you know?
Yeah.
Yeah.
Amazing. That's so helpful. Thank you, Dr. Brooke. Your insight is like I feel like I'm drinking from water that's pure versus like LA water, LA tap water.
Yeah, watch
Do,
that
yeah, no,
stuff.
no. Do you have any questions for me now that I can pass the mic over to you, or have we reached our natural conclusion?
Oh gosh, I don't know. I mean, this has been an amazing conversation. I'm really grateful to have this opportunity to communicate with people. I know I probably missed a lot. I probably forgot lots of things too. But yeah, I guess I'm curious, what was most surprising or interesting to you about what we talked about today?
I think the thing that's going to stick with me the most is the connection between social skills of girls connecting on average more with neurotypical boys. That one sticks out to me just because of personal experience and like I said, that anecdotal stories I have in my head. The second thing, because I have a deep connection to religious trauma, would be that the founding of ABA is shared with the founding of conversion therapy. It would make sense given how it felt to sometimes implement it. Just icky, I guess, would be the judgment I would put on it.
Mhm.
Um, and the other thing that sticks out to me was just how important language is. Like I am not one who is offended if someone corrects the language I'm using. And that's simply because I know how important it is for me to feel understood in my
Mhm.
diagnosis and my experiences, right? Framing how someone talks about you can be a very humanizing or often a very dehumanizing experience. So I think hearing how you speak about autistic people, ADHDers, like even just this conversation has increased my language literacy for interacting with this population. And it gets me, I feel excited to know that there are other things I don't know, that there are books that I get to go check out, that there are articles I get to go read and just kind of expound and expand my knowledge on this topic because I think it's only going to get more and more important, right? Like we're about to see probably a pretty intense cultural policy shift because there is a large group of people who believe it's linked to unscientific things or believe that it's a myth or have all of these stereotypes that we've talked about at the forefront of their mind. So education, understanding, and empathy are going to be hugely important in the next frontier of advocacy. Um, Not that they aren't currently, it's just I know that administrations play a big part in the culture of our country, and I think that we're going to see an unfortunate shift away from some of the policies that maybe you and I are talking about and towards some more harmful ideas, which I find the most frustrating and harmful ideas are the ones that are like set with good intentions. Like, oh, like our intention is to take care of kids. Like, oh, we agree on that. Like, cool, we're on the same page. Like, well, how do you want to do it? Like, I want them to be neurotypical. It's like, well, now we don't agree. It's like, so I think,
Mhm.
yeah, those are the things that are sticking out to me from our conversation.
Yeah, yeah. Well, thank you for sharing that and for the opportunity to be on here. Um, I just want to say, I guess the underlying thing, most important thing is there are different ways that brains operate and that one is not superior to another. And even when we talk about strengths, we also just need to be asking ourselves, like, where is each person's, like, what do they need? And it's not about other people not having needs. It's about like us asking ourselves, like, what do they need in terms of learning, right? Like one way that a brain operates is not just autism, ADHD, but dyslexia, dysgraphia, giftedness, intellectual disability. How can we I don't know. I agree with you that the word diversity has unfortunately become somewhat loaded in certain circles. But I think just how can we kind of help everybody accomplish, even if we look at it for the good of society, isn't it going to be for the better of society if everybody is like um, being able to be their best self and being able to thrive as much as possible rather than just sort of, being devastated in a crisis because they're being constantly invalidated. Um, I think yeah, I try to remain optimistic. I think we're just all doing what we can in our kind of corner of the world. Um,
Yes.
and I just wanted to share for any therapist, I don't know how many therapists are listening, but we do have a new training on tailoring DBT for autistic clients on CE Go. So it's an asynchronous training. That means you get on demand whenever you want. And the ascent model I talked about and lots of the other things I talked about are going to be covered in that training too. So if there's any therapists out there who want to learn more, that would be great. opportunity. So
Absolutely, yeah, and I'll be sure to link that, like just a direct link to your website, and then maybe even to that specifically in the video description.
yeah, that'd be awesome.
Amazing.
Yeah.
Cool. Well, I'm gonna wrap up the recording, but don't go anywhere. I'm gonna hang out afterwards. But everybody, thank you so much for joining in, and thank you to Dr. Brook for being here with us. And I will see you on the next episode of A Manic Odyssey. Bye bye.